Hello, and welcome to the Men's Therapy Directory Podcast, the podcast that empowers men through psychology. Today, my guest is Dr. Yakov Barton. He's a licensed psychologist, speaker, and instructor in the San Francisco Bay Area. He received his PhD in clinical psychology at Columbia University. Dr. Barton's research examines the potential for psychological turmoil to catalyze personal growth and transformation. He strives to reduce psychological stigma and believes that a successful recovery examines the genetic, developmental, interpersonal, intergenerational, and cultural roots of mental health. In his private practice, he specializes in trauma-informed therapy for depression, anxiety, and addiction. Dr. Barton, welcome to the podcast.
So good to be here. Thank you, Michael.
Great to have you here today. I wanted to kick it right off because we are talking about men and men's therapy, and I just want to ask you, what do you think are some of the barriers to men just simply seeking help and getting into therapy?
That's a really good question. I think there's a lot of them, and I don't know if we can explore them all today.
Yeah.
I think the most long-standing barriers are just stigma around men expressing themselves and being vulnerable, which I think is probably some of the strongest barriers and some of the most challenging to overcome. My sense is that, especially in our culture, men are not raised talking about emotion, feelings. It's not modeled to them by male role models or their male role models, and it's very much intergenerational. That can be a big barrier, especially when, seeking out mental health support can be seen as weakness or be seen as, crazy or abnormal or whatever the negative descriptor is. So I think that's kind of one of the core wounds of kind of the masculine right now in seeking out support.
Definitely. Yeah, I think that's, I've seen that in my private practice as well. I want to ask you also, what are typically some of the issues that you see that men bring into therapy, or what's their sort of like presenting, condition or something that you see maybe most frequently?
Yeah. Well, a lot of the men that I see tend to be at a point where things have gotten so bad that they're finally willing to consider, even with the stigma, even with the barriers that I think work against seeking out support. So especially with the men that I see who are taking steps towards addiction recovery, things have just gotten so uprooted and there's been so much upheaval in their lives that there's a certain level of fear and desperation, which oftentimes that's a really good time to get traction because there's denial is being melted. There's a readiness for change. You think of the stages of change and moving past kind of even being pre-contemplative or even being willing to consider that there's some sort of problem, serious problem that needs attention. Usually when I see, and particularly men, although it's obviously not just men, but things have progressed to such a bleak point that they're just needing some sort of change. And especially if they've been raised kind of, with not really giving legitimacy to mental health care, it tends to be pushed even further. So I find, related to your first question, the bigger the barriers, kind of the more things have progressed and the higher the level of desperation or crisis, especially in the recovery community. From substance use problems. That tends to be the case, and especially men that have had no prior contact with therapy in the past or haven't had close family members or friends that have kind of normalized therapy or they've seen benefit in the past.
So sometimes people you'll see will just be like ripe for therapy. They're at that point where they have to change. Like they've just feeling like this has gotten so out of hand that it's not even like I need to be here. It's not like someone's convincing me or I'm kind of thinking about it or, my partner says I should go. It's like, I'm ready.
Right. And that's really the only way to benefit from therapy is with that level of readiness. And, ideally, I don't want to see people progressing that far and suffering so much before they get support. It might not be ideal in some ways, but in other ways, because there's so much resistance or denial or unreadiness that, if someone else were to push them into therapy, there might just not be any traction, which in some ways therapy can delay things. If there's a negative therapy experience, or sometimes therapy itself can become very codependent in nature, and even play an enabling role. But yeah, when people are at that point of deep readiness and there's just a certain level of surrender and openness to change and receiving help, receiving can be such a difficult thing for men. There's a part of me that's really excited in those moments, because it's almost like this kind of ripe fruit ready to be picked and take steps towards effective therapy. And I get excited because, like, okay, there's traction here. I think we can actually do something.
Yeah, no, that's great. They're definitely ripe and ready. Yakov, I was reading about on your website and your blog about when you were at Columbia, you were teaching, I think, about positive psychology and this notion of developmental depression. I was wondering if you could kind of expound on that notion of developmental depression. I find it really fascinating.
Yeah, this is a topic that's really exciting to me, and I think it relates to what we're already talking about, and readiness for change. We have a history of pathologizing most mental health symptoms and just sort of viewing them as almost like in medicine, the way we would like a tumor or something that needs to be removed, and not really looking at those symptoms in the developmental process. So whereas we've pathologized kind of all depression as bad the same way we might pathologize a headache, and we also live in an American culture of quick fixes, easy button presses, take a Tylenol, make it go away. We have a very similar mentality around depression. What my research found in my doctoral study was that, collecting, we were particularly interested in emerging age adults because there's so much transition and upheaval, and almost across the board, there's some depressed period during that age group. Sometimes it's mild, sometimes it's really severe and life-threatening, but almost everybody in this emerging adult age, which is typically defined as 18 to mid-20s, 25 or 26, there's some depressed period. So our question was, well, if depression is so ubiquitous in this age group and there's so much transition happening, is depression sometimes normative? And just a brief overview of this. I'd be happy to go into much more detail later on. But what we found is that the vast minority of depression appears to be pathological. There's sort of three subsets of depressive symptoms that we divided into. There was the actual mood symptoms. There was the cognitive symptoms of depression, like hopelessness, feelings of worthlessness, low self-esteem, and then there was the behavioral symptoms like anhedonia, not taking enjoyment in day-to-day activities, low energy or motivation to do things, over or under sleeping, over or under eating, all those. And while most of the people that reported being in a depressed period were elevated in depressed mood, a small group had symptoms that were elevated across the cognitive symptoms and the behavioral symptoms. But actually the vast majority was just feeling really depressed, but didn't really have, especially the cognitive symptoms. There wasn't feelings of hopelessness, worthlessness, low self-esteem, all these other symptoms that we kind of assumed to be there. And the idea is that it looks like most people, especially during that age group, or I would, hypothesize people in major life transition at any age, depression is incredibly normative. So we coined this term developmental depression, that, when there is periods of major life transition or upheaval, depression is pretty normal. And it might even be a mechanism through which change happens, because there's this idea of depressive realism, where when we're in a depressed state, things become really sharp in focus, and our direction of consciousness and awareness is directed inward, and we can actually have a lot more clear perception of what's going on in us, being more realistic in what our needs are, overcoming denial. There's just a certain gravity to being in that state. And the hypothesis there is that this depressive realism can actually give us clarity into what's not working or what needs changing or how we're growing. So to kind of reframe a lot of depression as sort of developmental in nature, as opposed to immediately pathologizing and medicating it, I think is really important in just the overall positive psychology framework, viewing it as a potential growth tool, and maybe even something that if we medicated and anesthetized could be robbing a person with low-grade depression of the growing potential of that state of mood.
Right. No, I love that. I think most men that I've known, and myself too, I think in that area, there was a time period in my life, there was definitely some clinical depression or diagnosable. And I mean, I actually don't know any of my male friends who didn't go through a phase, like either during college or post-college, of just like actually being depressed for a short period of time. So, what you're saying is it's a great opportunity if you reframe it as a developmental phase in a way. And of course, we don't want it to get too severe that we're really worried. But like you're saying, if it's ignored or anesthetized or seen as something that is bad, pathological, like push that away. Don't look into that. Don't be reflective. Get your act together. That you're really kind of doing a disservice to maybe something that's very normative, like you're saying. So maybe someone go into therapy for a brief period during that time, they could really get a lot of kind of like existential answers and really get self-reflective instead of saying, okay, go get a job or go get another graduate school degree and you'll get over your depression. It's kind of like, I think that's a great thing to talk about more is the developmental depression. Because one thing I wanted to ask you about was, well, it would be like this. So if someone comes to see you for depressive symptoms, but I would call them quote unquote like high functioning depressive characteristics, where they're going to their job every day, they're able to hold, relationships are okay, and they're holding it all together, but they're just miserable. Like, there is hopelessness, and there are maybe these more severe symptoms that we're seeing, but yet on the surface, everything looks fine to everyone else. So it's like, I call it like high functioning, meaning that they're able to pay bills, keep their job, everything, put on, a facade. How can you help someone like that? Because it seems like there's maybe this moment of kind of denial of saying, where someone's putting on this show for themselves and they're keeping it all together, and that can go on for years and years and years. And then there's this, this depression feeling that's just there. And I'm wondering have you seen any clients like that? Because that really fascinates me, because again, I think in our society, there's this tendency to look at, like you're saying, depression as something that's really bad. So there's some people who can just either like use exercise or maybe mild alcohol problems and be a workaholic or something. Yeah, they're depressed. So I'm wondering if you've seen clients with that kind of presentation and how you would kind of break through to them or help them.
Yeah. As opposed to my work in hospital settings, I'd say I see a lot more of those clients in private practice settings. Can be a little bit self-selecting for various reasons. Thinking about particularly the men that we work with and our tendency to try to anesthetize and have easy fixes and, keep it all together and not show that there's anything wrong and still be holding together a job and, maybe medicating with alcohol or other things and, really struggling internally and living in a nervous system that is kind of inhospitable and destabilized, but just finding ways to sort of like keep it together and muscle through, which is such a masculine way of handling things. Unfortunately, it can lead to so much suffering. My first thought is really not trying to rush things along, slowing down and just kind of really seeing where the person's at that I'm working with, and being particularly curious with what's brought them to therapy. Usually there's a reason, unless there's someone in their family or a legal reason that they're needing to seek out therapy or being pushed to. I'm really curious in what's that kind of seed of motivation or traction, or what is that piece of dissatisfaction? Because oftentimes I'll talk to folks that are similar to what you're describing, and we'll have our first session, and it's just sort of, it's almost like making a case for why everything's good.
Yeah.
And it's like, okay, sounds like things are good, maybe.
Right. You're
That's
here
what I
for a
mean.
reason, obviously, but
Yeah, I know. But everything you're telling me seems like you got it all together, and it's, things
yeah,
look good on the surface, and, your job is still going, and,
yeah,
there's not these indicators of a big crash and burn
yeah,
happening. And sometimes those are the things that really, get people to wake up. So,
yeah,
yeah, I'm, as opposed to jumping into, trying to lecture, convince on the ways that I see, because usually there's little seams tearing in the story, and I'm like, well, things don't seem that good, maybe.
yeah,
As opposed to trying to point those out myself, I really just try to be curious,
hmm,
build rapport, see if I can understand or be trusted by this person to open up in a little bit more of a vulnerable way as to like, what was it that, here you are and you're 54 and you've never had therapy before and you're talking to me right now.
yeah.
So what, what
What's
changed
going on?
here? Yeah, what's going on? And
Yeah,
just to be really curious about that. And, there's such interesting power dynamics that can be pretty invisible between clinician and
yeah,
client. And I try to be really wary of those. And early on, build a dynamic of being on the same team of like, well, we're exploring this together. And
yeah,
I'm not in the role of, wise guide or guru or,
right,
expert that's up on this high horse, but I'm
right,
just here wanting to build trust and to be curious together, and look at this. And then as things progress and there is trust, then I try to maintain that dynamic
mhm,
of kind of no big kind of disparity in power, but I'll start to step into taking a little bit more of a disruptor role.
yeah,
And that's really a part of my nature just as a human, is I'm a very avid disruptor. And I try to do that in really
yeah,
gentle and curious ways. But I really think a lot of our roles as therapists is serving to disrupt, asking questions that can be a little challenging, but well placed and in a climate of good trust,
mhm,
that just start to disrupt the loops that we can all get stuck in.
yeah,
And I'm really curious about that process and how to fine tune the ways that I support that.
yeah.
So that's sort of my early inclinations in treatment.
Sounds like you're balancing the art and the science of therapy there. And so, Dr. Yakov Barton, I want to wrap things up. This has been a great interview, especially I'm interested in developmental depression now after reading a little bit about it. And I especially like how we talked about today, normalizing depression as, I mean, a human experience and something not to be afraid of. But there's men out there listening. Most likely all men have been through some depression, and you're not alone. And so get some therapy. It's okay, and nothing to be afraid of. So, Dr. Barton, it's been a pleasure. Thanks for
Real,
joining me today.
really appreciate being here and appreciate the work that you're doing to decrease stigma around men seeking therapy. So thanks again for having me.
Thank you. Everyone be well. Take care.